favorite things today, male facial sculpting. Exactly. I've never had anyone wave hi, but I love that. They do that to the audience. That means they're really excited about doing treatment. So we have a younger patient, already looks really good. So again, when I tell people with fillers, in the old days, we always were trying to fill lines or plump the face. That's not what we're doing now. We're doing anatomical filling or feature enhancement. So what we're gonna do when we look at his face, we're just gonna build out certain areas. We wanna lift the cheeks slightly, define the chin and jawline, and make the lips a little more symmetrical. It's all about balancing the face, harmonizing the face, and making it look more masculine, not about size and not about filling lines. So let's start a little bit in the mid-face. He actually can pull off a little bit of a more sculpted look to his cheek. So what I'm gonna do is we're gonna come a little bit more medial. We're gonna treat this almost like a cheek implant where we come out horizontally and we build that little apple so that when at rest, it looks like he has a little more chiseling to the face. We're using Restylane Define. This has actually some really good structure. And that the reason I actually really like this filler in guys, if they don't want something that's more long-term or semi-permanent, is this one lasts a while, but it also has good structure. So you could even build out areas like the cheek and jawline, and you see how they, in that little bit, just made that feature enhancement. Come from the side, you can show them on the side, just that pop that we're seeing there. What are they saying, Jordan?
Do you want to know what filler we're using? We were just talking about that, guys.
Yeah, so we're using Define, and I'm actually gonna come a little laterally on him because his facial structure can allow me to come a little higher and a little more laterally. We don't obviously overfill the mid cheek because we don't want him to look when he's smiling like he has filler. We don't want his eyes to look closed, and we don't want him to look as he's too much volume. We're placing this in 2 different levels. Perfect. Switch to the other side. And now we're gonna balance the other side doing the same thing. Now, I would show them both sides because that's a syringe, Jordan, and I know everyone freaks out when they say multiple syringes. They think it's like tons of volume. But if you take a look, turn to me just a little bit. Now look at that OG curve. Look at the line that's been created between here and here from the side. So you can actually see the angle to his chin, which we're gonna widen. So now he has a enhanced feature. It makes him look more
People
sculpted.
are asking questions. They want, is that Bellafill? No, it's not Bellafill. Bellafill's gonna be white.
No, it's not Bellafill. You look like Chris Evans. That's what I was just thinking about. Well, who does he
Do you
look
numb
like?
prior? Yes, we numbed our patient prior with
You know
topical.
who that is? Isn't that the guy that was Marvel?
Thor, right? Was he Thor? No.
No,
Captain
that's
America.
no Captain America. Yeah,
Captain America.
Yeah, that's what he looks like. He's
Thank
the
you.
same
Wow.
features as him. Darker hair, but yeah, he has the brother, the one brother that's also an actor, right?
Yeah.
He's in the funny movies. So we're gonna do that same thing over here. This is definitely not Bellafill, you guys, although you can use Bellafill, which would be a long-term treatment option on the bone. This is Define. Now Define has a very specific sort of holding capacity. It moves with your face, so it blends in. It's almost like honey to the area. It kind of molds to that area. So that is why I like it. The issue with it is if you don't place it properly, you know how hard it is to remove honey from your hands. Can you imagine when it's on the bone? Not gonna happen. So we gotta place this right. So I do it in 2 different layers to get it to be perfectly even. We're gonna work our way out. Perfect. So again, we do want to have some feature enhancement on him. Hold there. Now we'll go to the chin. So now he has more structure. That looks really good. Looks amazing. Turn to me just a little bit. So he does have a little bit of a dimple in the middle part of his chin. We don't want to get rid of that because that's his natural look. But we're gonna widen this a little bit by going directly on the bone and building this out. Why do I want to build this out? I'll show you in a second. So on his face, he has a wider jaw and chin. So when this line is drawn from here and we go down, we want to widen it so that it matches a little bit more laterally, because his lip is longer.
How much per syringe?
I don't know.
It's gonna vary depending on the syringe that we're using, how many, all kinds of things. So guys, send us a DM, full name, email, phone number.
Make an appointment. You can also get injections by Nisha, our PA, who is trained by me, who's getting really good at facial sculpting too. So you guys see we're really widening this a little bit. Now one of the things we're gonna do, because the cheek is a little higher now, is we're gonna bring this out just a little more laterally, so I'm gonna give a little support, almost if we were doing a chin implant, along the side of the chin, and this is gonna balance the chin a little bit more. Same thing right here.
How long
Again,
is this gonna last?
this will last him about 9 months to a year. It depends. He works out a lot. You can tell that he's muscular, so sometimes it maybe dissolves a little quicker, but the define tends to last a little bit longer than a lot of the fillers.
What's the long-term side effects of using HA fillers?
Nothing really. I mean, they dissolve. This is your natural. It's the same filler that's in the same hyaluronic that's in your skin naturally. So there's really no long term unless you got a complication. That looks amazing. So now turn this way, the other way. There you go. Look up a little bit. So now we're gonna go right into the angle of his jaw. And we're gonna do a little bit on his jaw, just a slight enhancement. And this is gonna make the jaw a little bit more angled at the 90-degree. Sort of pop out. Give him a little width here. Awesome. Perfect. Now we're going to the other side, turn that way, and do that same thing. So again, finding that angle right where we want it to pop. And guys, we want to give not just a 90-degree angle, we also want to give a little bit, just a small amount of volume, so look straight for a sec. Now bite down a second. Good. So there's a little bit of volume there. So a little height to the cheek, definition on the chin, and a little bit to the jawline. And then lastly, the best part, the lips. So ice again the lips. Now with guys, we want the lips to be very subtle. Okay?
Someone wonders if this is what Amber Heard had done to her cheeks.
Amber needs a lot of things done. Okay, even though, I mean, she used to be so beautiful. I don't know, I can't tell you guys. So here's the thing, if you take a look at his lip, it angles out here more, but it kind of comes in a little bit more here. So the goal is gonna be to kind of just bring out, if we can, slightly, the edge of this lip, so it's a little more even compared to the other. I'm not gonna be able to do full pink show, but you can see already just that little bit already made a difference. So now I'll define a little bit. This is softer, this is silk. We used to use this a lot for what I call hydration filler. It's just a softening filler, but it does make the lips look natural, especially for guys. Okay, smile for me. See, now you see how it's now even on both sides in terms of the pink? So I'm gonna let that sit a second. Now I'm gonna come to the middle, just do a little bit. Because remember, what's our balance proportions? 2/3, 1/3. So at the bottom it'd be 2/3 size of the top. Good. On this side. He's doing great, especially since lips do hurt a little bit. What are they saying? They're being nice today. That's good. Okay, so the bottom's done. Again, trying to get this upper part to just come up a little more because his right side is a little less even. Alright, last little bit to do. That looks really good. Final little bit. Right at the Cupid's bow. Define the Cupid's bow just a little. There we go. Perfect. Okay. So keep them laying back like that. First thing we're gonna do is Emer reveal. We'll lean you up on the side. Hold on. Just wanna clean everything. As clean as possible. Less blood. Less of the shock.
How many
You see
how many milliliters did you use?
So we did 5 syringes? How many?
5, yes.
1, 2, 3, 4, 6.
5 and then the lips, yeah.
6 syringes. Okay. So let's lift him up. Hold on. Now we're gonna give him the phone first. We're gonna do Emer reveal first. So the Emer reveal, it doesn't show it as good because it's on the iPhone, but it's good if someone sees it and they're happy, then we know they're gonna love the mirror. All right, show him, give him the phone.
Alright,
Take a
there we
look.
go. Grab the phone.
Take a look and tell me what you think. Wow. What were you going for? Oh my God, it looks really good.
Yeah,
You do look like Chris Evans, see? You do.
My face
What
is
do you-
really numb. So
That's okay, that's
I feel like
good.
I look crazy right now. But, yeah, the chin is everything. Yeah,
It
We're
is,
definition.
it is. It makes a huge difference. The good thing with you about the chin, so let me show you. So you see how we kind of created this line? Stay straight for just 1 second, I'll show you something. Create this line, it comes down, and then when we draw a line down, that's where the edge of the chin should be, so that you have this sort of, not hollowing area, but a sculpted area. That's why this enhancement here and over here, chin and cheek, bring the face together. A lot of guys get nervous about doing the cheek, but that's what creates this whole structure. And then if you turn to the side, you can see your jaw. Come a little closer. Show them on the angle of the jaw. You bite down a little bit. You can see the width, the lifting, and the sculpting there. And then what do you think of the lip? Zoom in on your lip.
Big difference. Yeah.
More even, you know?
Yeah, for sure.
And that's the key, hydration and not overly done.
Okay.
So now let's look in the mirror. Let's show them the regular reveal, because you'll be able to see it much better. What do you think now?
Yeah, much more symmetry in the lips for sure.
So we wanted a subtle look, we wanted a natural look, a more masculine look, nothing too overdone. So again, a little bit to each area. The chin really a little more boosted, cheek sculpted, and jawline defined. Just hydration of the lips and symmetry. I think it's a great result. What do you think?
Yeah, okay, thank you.
Love it. All right, you guys, that's male facial sculpting with a quick pan, and we're done. Just sit there and relax. Show them off. That looks really good. Excellent. We'll do that. Awesome.
Cool, thank you.
Looks so good. Yeah.